Good afternoon, everyone, and thank you so much for joining us for the 2019 NSGC Annual Business Meeting. This is Amy Sturm, your 2019 NSGC President, and I am joined today by Carrie Atzinger, our 2019 Secretary and Treasurer. We will move now into our agenda. So today we're going to cover a lot of material, and one thing that you might notice if you were present in Salt Lake City for the State of the Society address that I gave there, we will have some information that we are sharing again, and so you might hear a few things that you had already learned about in Salt Lake City, but it's really the imperative and the legal responsibility of the NSGC to share certain key pieces of information related to our financials and all of our investments in both operational and strategic areas for you all to learn about. And so we really need to bring that to you today in our business meeting as well. We're also going to talk a lot about the future and what we hope to achieve moving into 2020 to start implementing additional pieces of our strategic plan. And then we'll also provide some high-level updates about communications, publications, and also go through the highlights of our nominations and elections process. We also will have an open Q&A session at the end, and so we will take some questions and answers. We already have received a few questions ahead of time, and we did work the answers to those questions into today's presentation. And then also, as a heads up, we will be sure to, if we don't have enough time to address every single question that comes in, we will compile answers and publish those on the NSGC website, and then those will also be available for all of you as part of the recording for this presentation. So to start off and launch into the presentation, we always want to reflect on the mission and the vision of the National Society of Genetic Counselors. And our mission truly is to advance the various roles of genetic counselors in healthcare by fostering education, research, and public policy to ensure the availability of quality genetic services. And really, this is to achieve the overarching vision of integrating genetics and genomics to improve health for all. So to start, really kind of at a big picture view, looking at the NSGC at a glance, we are now over 4,000 members of our society, which is really exciting, and our membership really just continues to steadily grow each and every year. We now have 21 special interest groups that you can become a member of as well in different specialty areas and also unique areas like leadership and management. We have official liaison relationships with over 25 organizations, and then we also have many even unofficial relationships with organizations beyond these 25. And what really I think is always just so amazing to reflect on is the sheer force of our volunteers in our society and truly how engaged our membership is. So while we have 1,000 plus member volunteers, there are still countless opportunities to get involved, and I will be sure to share with you some more information about how you can do that later on in today's presentation. So how do we really achieve what we need to as NSGC? One thing that we do setting out every few years is to develop a new strategic plan. And the board of directors works with facilitators to really build out what is the strategic vision of the society going to be moving forward. And we typically develop a 3-year rolling strategic plan, which means every year we reflect back on the current strategic plan. We see where it may need to be updated because, as you all know, we really are a living, breathing, evolving society, and we always need to make sure we are addressing the current issues we need to be addressing. The strategic plan and its priority areas then gets put into what we call our annual plan of work. So each year we have a new plan of work, and it's really from that plan of work that the charges for all of the different NSGC committees are built upon. And then our committees, our task forces, advisory groups, working groups, SIGs, and other groups within NSGC truly are the ones to put this vision into action so that we can achieve all of our goals as a society. So I really want to start off again by highlighting all of our amazing volunteers that share so much of their time, expertise, enthusiasm, and vision with us over the year. This is a slide showing your 2019 Board of Directors, and the board truly is responsible for setting the strategic direction for the NSGC. And it's really this group of individuals who are responsible for representing our membership as we look for opportunities to capitalize on, but also threats, and consider what we need to be working on to advance every single one of our members. I'd like to give a very big welcome to our incoming 2020 board members, starting with Sarah Riordan, who is our 2020 president-elect, Colleen Campbell, our secretary-treasurer-elect, and then 3 new directors at large, Michelle Fox, Sarah Pirzadeh Miller, and Shivani Nazareth. We are so excited for them to be joining us on the board to continue to enact our strategic vision. As I alluded to previously, it really would not be, we would not be able to accomplish all of our strategic goals without our NSGC committees. This group of individuals who are so dedicated to NSGC and bring such varied and diverse expertise and background and experiences to the table are truly who get the work done at the end of the day and really advance the society. And so we just want to take some time to highlight all of our chairs and vice chairs, starting with Access and Service Delivery, Jody Vento and Deanna Irwin, Education, Carrie Guy and Taylor Berninger, Marketing and Communications Work Group, Rebecca Moore and Rachel Shapira, Membership, Katie Bergstrom and Christy Hull, Outcomes, Megan Cho and Stephanie Cohen, Public Policy, Layla Jamal and Corey Feist, and Practice Guidelines, Sarah Kalia and Cindy James. I wish we were all in person together so that we could give you a huge round of applause, but please just know your efforts are so very appreciated. And again, it really is the efforts of these committee chairs and vice chairs that are really what allow us to achieve our strategic goals. Moving on, I mentioned earlier that we have 21 special interest groups. And this is a list showing all of the different special interest groups along with the co-chairs of these groups too. So we wanted to make sure that we were able to take some time and highlight these leaders within our society and show another snapshot of the depth and breadth of the NSGC volunteers. Moving on now to some of our task forces. I think many of us on the board of directors stated several times this year that this truly seemed to be the year of the task force, because when we really dug into the 2019 to 2021 strategic plan, there were really big issues that we had to tackle and that we needed a lot of help to do. And so 4 different task forces were put together. The first I would like to highlight is the Diversity and Inclusion Task Force. And these are the amazing members of this task force pictured here. We want to thank you so very much for your extraordinary work, the thoughtfulness you put into this work over the course of this year. The NSGC Diversity and Inclusion Task Force was convened to really review existing efforts, identify gaps, and propose a new path forward for the NSGC. The recommendations and summary of their activity was delivered to the Board of Directors on October 14th of this year, and I will provide you with some more updates from the work of this task force later on in the presentation. Another one of our task forces is that of NSGCares, which was co-chaired by Jay Flanagan and Sarah Noblin, and the other members are listed here. And this is a picture of our 2 great co-chairs at the annual conference in Salt Lake City, highlighting their work as part of the Rare Bears community building event. With NSGCares, we really wanted to build on our foundation of community and connection. And so the Board of Directors established a strategic initiative to formalize our community building efforts through NSGCares. And the efforts of this group will really be aimed at increasing support for genetic counselors and for those in our professional networks, our patients and their families that we serve, and organizations and communities that support them. Moving on now to the NSGC Pathways to Genetic Counselors Task Force, which is ongoing and is chaired by Jehannine Austin. This group will continue to work into 2020 to develop a tool to identify individuals best served by genetic counselors. And I will also be talking a bit more about this task force later on this afternoon. And finally, our last task force was that of the NSGC Research Task Force, chaired by Leah Center, with the members of this task force listed here. And we had representatives from the Outcomes Committee, Practice Guidelines Committee, Access and Service Delivery Committee, the JEMF, our Research SIG, the Journal of Genetic Counseling Editorial Board, and practicing genetic counselors. And the objectives of this task force were to really establish the research agenda for 2019 to 2021 by identifying our priorities and developing recommendations for infrastructure and funding, with the overarching big picture goal of demonstrating genetic counselor value. So again, huge thank you to all of our dedicated volunteers. We definitely could not do any of this work without you. And here I just highlight a few additional groups, such as the JEMF and Audrey Heimler Special Projects Award, Rolnick, our liaisons to the different groups, our Ethics Advisory Group, of course, our amazing volunteers that make up the annual conference and abstract committee, and then all of you who are also connected in some way to the Journal of Genetic Counseling Perspective, and many additional individuals, contributors. Thank you so much. So, if you are excited by listening to this or have volunteered in the past, we really want to stress again that all are welcome and we need you. There are so many ways to get involved in NSGC, and if you don't know where to start, we have some ideas for you. You can check out our Volunteer Opportunities Discussion Forum in the NSGC community section of the website, and committees are posting many opportunities there, especially at this time of the year. But you can also subscribe to emails from this forum if you want to be notified as new opportunities emerge. We're also going to talk about other ways that we communicate with you later in the presentation. And know that we can only have a diverse and inclusive society if we get a diverse group of people involved and engaged. NSGC is truly your society, and we want you to help design and drive our future. Now moving on to the 2019 nominations and election update, and truly how we consider building our leadership pipeline. So as a reminder, the nomination and elections process is overseen by a committee called the NSGC Nominating Committee. The committee is made up of 4 at-large NSGC members selected by the membership committee from individuals who respond to an open call for applicants, along with the NSGC president, immediate past president, and 2 non-officer board members. If you are interested in helping identify the future leaders of our organization, I strongly encourage you to submit your name to participate on this nominating committee. Our process depends on the involvement of NSGC members, and I can attest to the fact that this is truly one of the most interesting and rewarding committee experiences within NSGC. If you're interested in learning more, please feel free to contact the executive office for more information about being involved. Similarly, we need NSGC members involved in nominating individuals for consideration for the slate. If you are interested in serving your society in this way, we encourage you to nominate yourself. If you know someone who should be considered for the board, we encourage you to nominate them. The success of our process depends on the nominations we receive, so please get involved and submit nominations. Here you can see the results from this year's election, and you can also see the voting participation rate over the past 10 years. 32% of eligible voters participated this year, with 95.6% approving the slate and 4.1% abstaining. I would now like to hand it over to my colleague, Carrie Atzinger, our Secretary-Treasurer, who will review this year's NSGC financial report.
Hello, everyone. I'm glad you're all here and excited to share with you the financial health of the NSGC. So first off, Amy mentioned earlier the membership growth, and this just shows that over time. And so our society is really healthy in terms of members. We also have great attendance at the conference and had a record year this year. We even beat our previous record of attendees from Seattle. In addition, just thinking about the future, we've had a 6% growth in student members this year. And amazingly, at our conference, 26% of attendees at the conference were first-time attendees. So that is really exciting. So I'm going to show a couple slides that show the financial health and financial trends of NSGC over time, starting with this one. To orient you, the orange line on this graph is representing the operating and strategic expenses for NSGC over the past few years. And the yellow line is the operating and strategic net income. When I say operating means the things we do year to year. So the conference, the website, education, public relations, those sorts of things. The strategic part of the budget is new initiatives, things to drive forward the strategic plan. Sometimes these things over time become operationalized, but they're things that at this point need a specific focus or are a specific project. You can see with increasing membership comes increasing revenue and increasing expenses. So our expenses have gone up over time, and that has been partly intentional to make sure we're investing back into the membership and into the profession. The net income, you can see, was positive and is currently in the red, and that's, again, intentional to spend money that we're bringing in and that we have in reserves to invest in the membership and in the profession. So this also shows the financial health of the organization. We are extremely financially healthy. We have, so what you see on this graph here, the blue line is our unrestricted net assets, so our reserves. And the orange line is sort of best practice in the industry, which is about 50% of operating budget. So the blue line, as you can see, has gone up over time, but is starting to come down, and that is intentional. That's not a concern. That is because we want to very thoughtfully and strategically spend those reserves in ways that will drive forward our strategic plan in the way that we think is most effective. And so we don't want to spend those reserves too quickly. We want to have money to invest in strategic initiatives over time, but we want to make sure we're using those most effectively to drive forward our strategic initiatives. So this slide shows our assets as of the end of 2018. So those are the final audited numbers for last year. Our cash assets, so liquid assets, were $2,599,231, and the value of our investments at that time was $1,518,259. And you can see there then the total unrestricted net assets at about $3.5 million. I keep saying unrestricted, and that's because we do have some funds that are in separate accounts that are restricted to be used for specific purposes. So that includes things like the Jane Engelberg Memorial Fellowship Endowment, the Audrey Heimlich Special Project Award Fund, and the Rolnick Fund. So those aren't reflected here. For 2018, we budgeted a revenue of just over $3 million, and the actual end of the year revenue was slightly above that at $3,283,069. Budgeted expenses for last year were, again, about $3.5 million, so $3,514,330, and then the actual expenses were, again, slightly above that at $3,613,712. So our net budgeted revenue was a negative $399,887. Again, that was a planned investment in the strategic plan and our membership. At the end of the year, we did have a deficit a little bit less than we had budgeted, so $330,643. These next two slides just show the diversification of our revenue and expenses. Our largest source of revenue is from the conference, and our second is from membership. But we do have a number of other sources of revenue. Publications, that includes things like the Journal of Genetic Counseling, which has really seen a positive shift in its revenue over time with our switch in publishers to Wiley. We also have revenue from being a CEU provider, from year-round sponsorships, and from online education. In terms of expenses, our conference, I mentioned, is our biggest revenue, but it's also our largest expense, followed by general administration of the day-to-day operations of all of our committees, all of the different infrastructure for the organization. And then you can see all of the different categories of things where we're investing: federal, state, and payer advocacy, branding, marketing, and PR, publications, membership, website, leadership development, being a CEU provider, committees, things like that. So in terms of looking forward to 2020, we have a number of goals. We want to continue to maintain a healthy financial base so that we can continue to drive forward our strategic plan into the future. We want to ensure operational support for the growing membership. We want to make sure we have enough invested in operations that we are able to meet the needs of our membership even as we grow. We want to invest in our strategic plan in a way that's going to benefit the profession, but while also remaining conscious of the total amount we're spending in any given period of time so that we have, again, reserves to invest in the strategic plan in future years as well. And then we'd also like in 2020 to explore additional partnerships and other ways to diversify our sources of revenue. So where are we at right now? This is the 2019 budget and forecast. By 9+3 forecast means that that's 9 months of actual numbers and then 3 months of predictions based on those numbers. So we budgeted for 2019 a revenue of $3,588,466. And our projection for the end of this year is that we'll be, again, above that at $3,660,890. Our budgeted expenses were $3,822,321. And our forecast for the end of this year is that our expenses will be at $3,742,216. So the budgeted net was a loss of $193,321. And right now we're predicting that we're going to come in around $78,326 as a net loss. Again, intentional. So this isn't a concern, this is an investment in the future. Now I'm going to hand things back over to Amy.
Thank you so much, Carrie. So now we're going to really review the 2019 year and dig in on some of our strategic initiatives and the progress that we made. So let's start with service delivery, Strategic Initiative 1. This is really focused on the promotion of the delivery of high-value genetic services to all consumers based on individual needs, and includes goals such as increased awareness, the development of collaborative care delivery models, identification of individuals who may benefit most from genetic counseling provided by a genetic counselor, and ensuring that we are all able to practice at the top of our scope. So I wanted to highlight again the Pathways to Genetic Counselors Task Force. NSGC is committed to promoting the delivery of high-value genetic counselor services based on individual needs. Various different groups are working to develop reliable methods of identifying individuals across specialties who will realize the greatest benefit from genetic counselor services. The objective of the Pathways to Genetic Counselors Task Force is to develop a broad tool targeted at patients and health consumers to help them self-identify as an individual with needs that are optimally and appropriately addressed by a genetic counselor. And we're really excited to see where this task force continues to go into 2020. This is a list highlighting the different organizations that NSGC and our liaisons have had active interaction with on a leadership level over the course of 2019. So just take a moment and look at this list and reflect on that. These are active, ongoing discussions that NSGC is having with this very large, very diverse list of groups. We know that there are even many beyond this list that our committees and SIGs have interacted with during this year. But we wanted to provide this snapshot for all of you so you can see the breadth of our reach and the many different types of organizations seeking our partnership, input, endorsement, or engagement. And with many of these organizations, we are discussing how genetic counselors and the healthcare providers they represent can work together and most effectively to provide genetic services. So now let's move forward into access. As you all should know, we have our new bill, HR 3235. We had to work to get this bill, the Access to Genetic Counselor Services Act of 2019, reintroduced into the 116th Congress. Earlier this year, I had the opportunity to spend a day on the Hill in January advocating for NSGC and our bill with our Director of Government Relations, John Richardson, and our lobbying firm, Capital Counsel. Here you can see additional advocacy efforts that NSGC has in action. We have been building bipartisan co-sponsorship of the bill, have written an op-ed in the Hill, and have spent time on the Hill with our colleagues from ABGC. In addition, over 230 organizations have signed on to a group letter of support for the bill that will be delivered this week, and we're really, really excited about that. One of the questions we received in advance of today's business meeting was regarding ACMG not being listed on this letter of support. ACMG declined to sign the letter. ACMG's president, Tony Gregg, informed us that ACMG does not support language that would permit genetic counselors to order genetic testing. While we explained scope of practice issues are regulated by the states, Dr. Gregg stated that ACMG would not sign the letter because Medicare beneficiaries could be in jeopardy in the states where we are allowed to order genetic testing. NSGC strongly disagrees with their position, as data from multiple stakeholders demonstrates when genetic counselors are involved in the genetic testing ordering process, better outcomes, including cost savings, are observed. Another question we received was regarding the timeline for the bill. And truly the timeline to move forward is up to Congress. But if all genetic counselors answer calls to action, enactment could happen sooner. The bill would become effective 1 year after enactment, and the bill would allow genetic counselors to provide Medicare beneficiaries services independently rather than under the supervision of a physician, as you are now required to do even if you are licensed as an independent practitioner. It would also allow Medicare referrals from physicians to come directly to genetic counselors. Finally, it would also reimburse genetic counselors for services to Medicare patients. As to how the bill will impact billing practices day to day, that will vary by institution. But NSGC will provide broad guidance for you to take to your institutions to start those conversations about implementation on a local level. So how can you continue to help? Well, on our website, under advocacy, we have ongoing ways that you can engage and help spread the word about HR 3235. And one of the key things that I would like to mention is if you are going to be in Washington, D.C., please reach out to the executive office. Please reach out to John Richardson, our Director of Government Relations, because one of the most impactful things that you could potentially do is meeting with your members of Congress in person, help them understand this bill, help them understand what genetic counselors do. This is really one of the best ways that we have been able to build our current list of bipartisan co-sponsors. We also have additional grassroots efforts that are supported and led by our Public Policy Committee within NSGC. And the NSGC Board of Directors will again be going to the Hill in February of 2020 so that we can meet with our different members of Congress and continue to advocate for the Access to Genetic Counseling Services Act. We also will be using work that has been done really over the years, many years, by the Access and Service Delivery Committee to help prepare for SCORE by the Congressional Budget Office, or the CBO. So highlighting now state licensure, we currently have 29 states with licensure. So the majority of states in the US now have licensure, with 4 new states passing bills since our last annual conference and other states in process. And NSGC will continue to invest in licensure grant awards, maintaining our funding level of $80,000 to support ongoing success. We also would love to highlight our position statements. Position statements truly represent the public voice of the NSGC. And something really important to remember is this whole process of developing and writing position statements incorporates your voice, meaning the membership of the NSGC. One of the last steps in the position statement development process is calling for member comment. And truly, your input at this point in the process is implemented and reviewed both by the Public Policy Committee and also by the NSGC Board of Directors. And it's very important that you share your expertise and your views as members so that our position statements really do reflect the voice of the NSGC and our membership. And I can definitely attest to how helpful these position statements are. They have been used many times over the course of this year in our conversations with media, payers, policymakers, as well as being able to have these accessible to the general public for them to see where we stand on certain issues and to provide guidance on these topics. And this year we had 2 different ones that were updated, the at-home genetic testing position statement and the secondary and incidental findings position statement, which will be coming very soon. So moving now forward into research. This is our 3rd area of focus, and NSGC has really realized the need to accelerate research to expand the evidence base for genetic counselor services and demonstrate outcomes from genetic counseling provided by genetic counselors specifically. A number of different research initiatives are underway within NSGC and within the community at large. And while each of these existing efforts are advancing the genetic counseling profession, NSGC desires to proactively coordinate and prioritize our resources, the types of resources that Carrie was talking about earlier, to truly advance research critical to the achievement of our strategic objectives. So to this end, that is why the Board of Directors chartered the NSGC Research Task Force this year. The Research Task Force delivered its recommendations to the board, which included an overarching research framework and a research agenda. And really what this was encompassed was building out more of a research infrastructure within the NSGC so that the agenda could be advanced, and fostering the development of a possible research consortium that could collect standard data elements across different types of genetic counseling specialties and really build capacity for research among our membership in different ways. Another recommendation from the task force was to establish a research committee to steward the NSGC's strategy and agenda and genetic counselor research. As an initial path to developing the research agenda, task force members identified gaps which, if addressed, would advance the profession. Drawing on this list of identified gaps and questions, our strategic plan and the long-term vision for our profession, 4 key areas emerged as the overarching framework for the research agenda. And these are highlighted here in this diagram and focus on access, genetic counselor clients, our processes and outcomes, and our value. And using this framework as a guide, the task force then focused its broad list of questions to a list of top 20 research questions. And these are questions that are really considered to be necessary to be answered to advance or accomplish the goals in our strategic plan, that are critical from a sequential perspective and critical from a timing perspective because of different anticipated or current outside forces, events, or policies that could impact our practice. And this agenda is actively being used to advocate for funding of genetic counseling research in conversations that we have been having with the National Human Genome Research Institute and other organizations. Moving forward now into our strategic goal of diversity and inclusion. Really what our strategic plan states is that NSGC will promote a culture of inclusivity that supports visible and invisible diversity and leverage that culture to expand the perspective represented in our field, build community, and foster equity in genetic services. And to that end, the Board of Directors charted 2 task forces that I previously introduced, the Diversity and Inclusion Task Force and NSGCares. The NSGC Diversity and Inclusion Task Force was convened to review existing efforts, identify gaps, and really propose a new path forward. The recurring themes that are a core focus of the recommendations include acknowledging our past, putting a structure into place to provide accountability, communication, and transparency, and exploring universal design to ensure our member benefits can be accessed by all. One of the major activities was development of the NSGC Statement of Diversity, Equity, and Inclusion. Strengths and weaknesses of the genetic counseling profession and of the NSGC were used as the basis to create this statement, which we now proudly display on nsgc.org under About NSGC as one of the core statements of our society, along with our mission and vision. The task force plans to submit a report summarizing the efforts of this group to the Journal of Genetic Counseling, Minority and Health Disparities in Research and Practice in Genetic Counseling and Genomic Medicine special issue, and an article providing a more detailed overview of their recommendations will appear in the November/December issue of The Advocate that will hit all of your inboxes on Friday, December 13th, and will also be posted on the NSGC member news blog on nsgc.org. I'd now like to tell you more about NSGC's new community building initiative, NSGCares. One major accomplishment of this task force was the development of the vision statement. And to this end, the board approved a vision statement, which reads, NSGCares embodies a foundation of community and compassion that is inherent in the work and spirit of genetic counselors. NSGCares is committed to engaging NSGC members, genetic counselors, and students in efforts to cultivate our inclusive community, support our colleagues, and connect with our patient and consumer networks. The NSGCares structure and framework will include both year-round activities as well as events at our annual conference for all of us to come together, such as our Rare Bears and on-site volunteer opportunities, an ambassador program with new NSGCares ambassadors to welcome individuals and make them feel comfortable at the conference, and then multiple different types of year-round activities, such as assisting individuals following a request for support, providing recommendations on member-wide issues regarding the profession like burnout, highlighting work that our members are doing in their local communities, and promoting other types of NSGC activities that relate to community building and/or supporting our members. So now we'll talk a little bit more about operations and really what we have invested in this year operationally. So let's start with our practice guidelines. Just as an FYI, this is another great volunteer opportunity, and the Practice Guidelines Committee is looking for new volunteers. Practice guidelines truly are very high impact for the NSGC and for our profession. They result in publications, but they do take the concerted effort of a number of volunteers, and these are critical for demonstrating the expertise of our profession. One major investment we made this year was hiring a part-time methodologist to support our author groups in completion of their systematic reviews. Since joining NSGC, our methodologist, Dr. Jennifer Malinowski, has provided critical guidance and support during the systematic review process, and in addition to providing this ongoing support, she is also building training materials for future author groups and the Practice Guidelines Committee members, which should help us accelerate our progress in publishing evidence-based guidelines in the future, an activity that is critical to ensuring evidence-based practice and advancing our influence within healthcare. In 2019, we also transitioned the current Professional Status Survey, or PSS cycle, to an annual survey to provide more frequent collection and publication of the most frequently changing data, such as salary and benefits, to support members in NSGC's various policy and advocacy efforts. The new annual PSS will make sure that we are collecting data every year on professional issues that may change rapidly, and we will also be able to this way provide annual updates for the most dynamic and highly requested data for use and reference by multiple different stakeholders, including our membership, the board, groups focused on workforce, etc. We also want to make sure that we are providing all of you information and support that you can use in negotiations with your employers by providing annual salary and benefits data. I'd now like to again just highlight some of the vast amount of education that NSGC has brought to you this year, and much of this education is still available for you to take advantage of. Our education committee and our SIGs have produced and reviewed an immense amount of content this year, providing continuing education on clinical topics, professional issues, and others. Just to highlight a few of the numbers, we have reviewed 140 Category 1 applications for CEUs and counting, 272 Category 2 applications and counting. Our annual conference had 79 sessions reviewed, and these were shaped into 36 sessions for 37 contact hours, so up to 3.35 CEUs available. And you can also make sure to buy those conference recordings if you didn't get an opportunity to attend the annual conference, or if, like myself, you weren't able to attend everything that you wanted to and would like to watch these later on demand. We received 482 abstracts, we had 50 platform presentations, and 404 posters at the annual conference. There have been 7 webinars for 7 hours of content, and 4 online courses, which is just really, really exciting. So thank you, huge thank you again to the full education committee, which represents over 180 volunteers to develop this over 120 contact hours of education produced. Thank you again to the education committee. So some additional resources for your practice that I wanted to take a few moments to highlight are, first of all, again, just make sure you are aware of all the different multitude of SIGs we have. Now 21 total special interest groups, with our newest this year being the ophthalmology and hearing loss SIG. And there are many new and ongoing tools that the SIGs are always developing and that are available to you on our member website, including new resources such as the digital tools for genetic professionals, which was developed by the Health IT SIG, and the consumer-driven genetic testing primer deck developed by the Precision Medicine SIG. In addition, would like to give a highlight to the NSGC Connect program, which is really the reimagined NSGC mentor program. And this debuted about a year ago, and this program has really evolved into a flexible way for you all to receive peer mentoring, networking, support, and this is designed for everyone. So keep that in mind, and really regardless of any career stage you are in, years in the profession, your specialization, your practice setting, your professional interest, this truly is for everyone to try to take advantage of. And one example that I think is a really great one is for those counselors who might be interested in exploring a move from one specialty to another. That's a great example of some relationship that you can develop by going on NSGC Connect and finding someone to connect with. So be sure to sign up, and this can be for a one-time conversation, a year-long relationship, or anything in between. So we talked a little bit about our conference growth and our membership growth, and again, we topped Seattle, which was really exciting with our numbers in Salt Lake City, and would also just like to excitingly announce again that next year we will be in Nashville, Tennessee for our annual conference on November 17th to 20th. And we are really looking forward to another great conference. The call for speakers has opened, so please be putting your thoughts together on what types of sessions that you would like to submit. We encourage everyone to consider submitting a proposal, and the submission deadline is January 20th of 2020. So now let's talk about the future and really where we're going to be going in 2020. So what's coming related to service delivery? Well, one thing we're really excited about is that we released a request for proposals, or RFP, earlier this year. And this was for the development of business cases for genetic counselors. And these cases would really promote the hiring, utilization, and retention of genetic counselors, assess the financial value proposition for genetic counselors, and provide business tools for you to use in your workplace. And the board is excited to move forward in 2020 with the input of the Access and Service Delivery Committee to fund this work to develop these business cases. So definitely stay tuned for more to come in 2020. Well, what about access? We are definitely going to continue to build our co-sponsorship for HR 3235. Again, please let us know if you're going to be in DC. We would love you to join John and Capitol Council on the Hill. We will be requesting a score from the Congressional Budget Office. We will consider a possible Senate companion bill. We will continue our progress with state licensure and increase our focus on payer outreach by performing additional research into genetic counselor value, professionally packaging our messaging with the help of our PR firm, and really building out a much more proactive engagement system with payers. Well, what about research? What's coming in 2020 for research? Again, the overarching objective of our research agenda is to promote evidence-based practice in genetic counseling. And this is so that we can bring significant and demonstrable value to our clients and to the healthcare system as a whole, to really achieve our vision of a thriving, growing, well-recognized profession whose value is proven. And we are going to do this by developing quality metrics for genetic counseling performed by genetic counselors within priority areas, including access, quality, and cost, and seek validation through the National Quality Forum, or NQF. The NSGC Outcomes Committee has been working diligently to develop and validate outcome measures for genetic counseling performed by counselors. As we've gone down this path, we've realized the need for both additional expertise to guide this process and a more refined infrastructure to collect the data we need to validate these measures for NQF endorsement. We're currently in the process of reviewing proposals from outside groups with expertise in these areas and to create the vision for what a data collection infrastructure could potentially look like within NSGC. A potential NSGC research consortium could foster standard data collection across genetic counseling specialties. This could include both institutions as well as individual researchers, who could each bring unique experiences and diverse patient population data sets to the table. The work done by a consortium could build the tools and capacities for broad data collection, which could address many of our priority research questions in our agenda. And moving on, for diversity inclusion, what can you expect in 2020? Well, we have a lot of things that we hope to enact in 2020. Again, that were part of the recommendations delivered to the board from our Diversity and Inclusion Task Force. The first of which would be to establish an official Diversity, Equity, and Inclusion, or DEI, advisory group, and also hire a DEI consultant to work with this advisory group to develop a plan for NSGC. We also want to review recommendations and move forward with implementation of universal design, and establish a method for regular communication about opportunities to be involved in all of these activities and efforts, as well as a place for members to give feedback. Just this week, the Unconscious Bias online course was launched, and we will definitely continue to have DEI content present at our annual conference moving forward. And finally, with NSGCares, we plan to have increased programming and a formal process for requesting support for members and other stakeholders through NSGCares. So let's move on now to our PR and NSGC publications update. We have had a really impressive media coverage year, and this truly results from relationships that NSGC has been able to build with national media by offering up our experts from the NSGC Expert Media Panel in response to major genetics announcements and breaking news stories. This is a highlight of outlets that we have had this year with NSGC interviews and messaging, and really we try to focus on big national consumer outlets to educate the public about roles genetic counselors can play in healthcare. Articles have ranged from multitudes of topics, including at-home and clinical genetic testing, prenatal testing, the bill, research, and more. We really work with the media to form these relationships so that they think of us when they need someone to comment on a genetics-related story. And as of the end of October, our PR efforts have resulted in 168 total media placements reaching an audience of 259 million people. So what about social media? Well, our social media presence continues to grow. Our channels are successful tools to disseminate important messages, not only to our members, but also to the broader public. And this really is a way we can highlight the amazing work you all have done and are doing. This also gives a way for the genetics community to collaborate and join together, really from across the country, but also the world. And since our audience also includes consumers in the media, we use these channels to post NSGC messaging, as well as helpful articles on social media sites like Facebook, Twitter, and LinkedIn. Our social media is also a great source to drive people to the member and consumer website, aboutgeneticcounselors.com, so they can learn more about what we all do. So thank you to everyone who already follows NSGC on social media and shares our content, and we encourage you to do so if you are not already. So how do we communicate with the membership? Well, definitely for big picture issues, we have our annual business meeting, what we're going through today. We have the State of the Society address at every year's annual conference, and we have the Advocate, which usually comes out on the fourth Friday of each month. We also have additional ongoing activity, including our Dates and Deadlines newsletter, the Link newsletter, and the Source, and these all come out monthly and include different types of topics. And then, of course, we have our discussion forums, our general one, but also for all of the different SIGs. And don't forget that if you're interested in looking for different volunteer opportunities, you can go on nsgc.org. And in 2020, we're really going to work hard to centralize this process and make it much more user-friendly and coordinated so that we can have better ease in identifying all of the great opportunities and volunteers who would like to volunteer. Highlighting now our Journal of Genetic Counseling, which has really just continued to see amazing growth under the leadership of Christina Palmer as editor-in-chief, her deputy editor, Melanie Myers, and associate editor, Robin Grubbs. The impact factor continues to increase, as well as our ranking among similar journals. We do have our new publisher, Wiley, and this has been really exciting because we now have a new journal website, new issue highlights section of each journal, enhanced promotion of our publications, and, as Christina announced at the annual conference, a new app that you all can download to view journal content. I also just wanted to take a few moments to again highlight a couple special issues of the Journal of Genetic Counseling. One focused on examining the exome that was published earlier this year, and then one focused on minority and health disparities, which will be coming out in early 2020. And finally, I wanted to really highlight our wonderful quarterly newsletter, Perspectives in Genetic Counseling. I know this is something that I always look forward to receiving in my inbox and reading really cover to cover. And thank you so much to our editor, Kristen Hansen, and our associate editor, Shelley Cummings, for all of the interesting, diverse content you continue to bring to us. So happy anniversary to us. It's pretty amazing, again, to think that this is the 40th year of the NSGC. It is remarkable to reflect on the fact that master's level genetic counselors formed this professional society in 1979, 8 years after the first master's degree training program graduation. All of the lived experiences and wisdom present in our history truly have given us the gift of an amazing foundation on which to continue to build our very bright future. And again, I would like to highlight the words of the late Beverly Rolnick. The growth of the professional has paralleled the growth of the NSGC. Onward and upward indeed to every single one of our members and to the National Society of Genetic Counselors. Thank you so much for your attention this afternoon. And we now have at least 7 minutes where we can take live Q&A, and we will also do our best to collate any additional questions that may come in and provide all of you with answers to those questions after today's business meeting concludes too. So thank you very much. So give us a moment, we're just going to review some of the questions that have come in. All right, thank you everyone. So we have received several different questions, and we were just reviewing those questions really quick so that we can dig in and start answering those. So thank you for your active engagement and providing these questions to us. So the first one I wanted to read and address was worded to us as, should we increase our budget for advocacy and public policy in light of CMS genetic counseling bill? So in 2020, we have definitely increased our budget to cover additional activity in support of our efforts to advance HR 3235 on Capitol Hill. We will continue to evaluate the level of support we are allocating toward this absolutely critical initiative. We have allocated significant dollars to our advocacy efforts with third-party payers, and we also have done this to encourage credentialing and coverage of services provided by genetic counseling and establishment of true genetic counselor networks. And just to give you a little bit more detail, we have definitely increased the amount of funding for government relations support so that we have more time and effort to support our Director of Government Relations, John Richardson, and his team in Washington, D.C. And one thing that we started, I think it was 2019, correct me if I'm wrong, Megan, we have Megan Carey here, our Executive Director as well, but we did hire a completely separate lobbying firm called Capitol Counsel to help advance our efforts on the Hill. And Capitol Counsel is a very established lobbying firm who has relationships with many different policymakers, members of Congress, and they truly have facilitated much of our work on the Hill, the visits that we are able to establish, not only with staffers on the Hill, but members of Congress. And so they've really, pushed this forward for us as well. And we have decided to continue to fund Capitol Counsel and this additional lobbying firm as we move into 2020 as well. So moving on to our next question, thank you very much again to the submitter of this question. So the question is, did the ACMG comment on the fact regular doctors with no, little, or outdated genetics training can order genetic tests and the rate of harm that can and has occurred from that? I'm unclear on how they feel that their genetics colleagues will cause harm when compared to all the non-genetics doctors ordering genetic testing who frankly should not be. You know, I think this is an excellent question, and I think that probably most all of us have similar reactions to this and similar questions to this exact one that you posed. So thank you again for raising this concern and this comment. And this is definitely something that we have discussed with ACMG. We have discussed this with the leadership of ACMG, both face-to-face when we meet with them at the different genetics meetings, and also in a more recent call when we met specifically with leadership of the ACMG to ask them to sign on to our organizational support letter. And while we did discuss this, the message from ACMG was very focused on the scope of practice for genetic counselors and how they do not support ordering by genetic counselors. They consider that to be under the practice of medicine. Again, I want to assure all the members that NSGC strongly disagrees with this stance. And as you all should know or likely know, ordering genetic testing is something that we have been working with in the states for licensure efforts. It is supported by multitudes of data showing that when genetic counselors are involved in the ordering process, outcomes are indeed better. And it is also part of our practice-based competencies that the Accreditation Council for Genetic Counselors have. So this is something that we firmly know is within our scope of practice, and we will continue to address with ACMG. But that is the stance that has been communicated to us recently. This is another related question that I would like to address, and the question is, what are we planning to do about ACMG's lack of support? So building kind of on my answer from the last question, we definitely plan to continue our discussions with the ACMG. We will be maintaining open communication with them, and we will continue to share information and data that supports our position. We have also established very strong working relationships with other physician groups who support us, who have supported the bill, who have signed on to the organizational support letter and who support genetic counseling, genetic testing ordering. And so we will continue to do that as well so that we can build a very strong coalition with physician groups and other healthcare provider groups in general. And we will be also working with hospital systems and working to reach out to legislators with whom these organizations have relationships with to continue to advocate for genetic counselor recognition. So I think those are all of the questions that related to the bill and to the question regarding ACMG. So I wanted to take a moment and pause and see if there were other questions that we might need to address as well. Okay, Carrie is going to answer a question that is related to the budget.
Okay, so the question we got was, when you add the investments and liquid assets, they add up to 4.1 million, but the posted total is 3.5 million. Did I miss an explanation for that? Thank you for the question. No, we didn't mention this, but the number, and this is on a previous slide, the number of total unrestricted net assets, that 3,501,949, also reflects accounts payable. So that means that there are certain obligations we know we have, like bills for the conference and things like that, that would be reflected in that total unrestricted net assets that weren't reflected in the two numbers above. So you're correct, the two numbers, the liquid assets and the investments, don't add to that final number because of some outstanding accounts payable bills that exist and aren't reflected in the other two numbers. I hope that makes sense for people.
Okay, please type us in a question if you wanted any further clarification on that one. Since we are at 2 after the hour, we will be concluding, but I did just want to answer one more question that just came in a couple minutes ago. And the question was posed, do we know if ACMG will stay silent or actively oppose HR 3235? I will say that ACMG has told us they support HR 3235 within the scope of practice for genetic counselors. And again, they have made it clear to us that they do not think genetic testing ordering is within the scope. Now, HR 3235 does not include any language whatsoever about the scope of practice of a genetic counselor. So again, we have communicated to them that this is a state issue. This is something that is addressed within licensure laws at the state level. And ACMG has said that they will support HR 3235. And we do have a letter of support from ACMG in support of the bill. They just said that they were not going to sign on to the organizational letter of support, and they communicated to us their reasons for not doing so, which again related to the scope issue. So I hope that helps to clarify that question as well. Again, for every single question we received today, we are going to be typing those up. And even for the ones that we answered live, we'll be sure to type up answers for those ones too, just so that everyone can have those answers really easily accessible and down on paper to help with any clarification. And if you have additional questions that we didn't have a time to address today, please do feel free to send those over. We're probably going to be closing out the Zoom to conclude today's meeting, but we definitely welcome you bringing these to us. Send those over to the executive office. We will work through them and get answers to each of them for you. So thank you again so much for tuning into the business meeting. We really appreciate our engaged membership. As you all know, I wish you all the best for the rest of your 2019, and looking forward to really bringing you additional highlights from NSGC as we move into 2020 and beyond. So thank you so much. Bye-bye.